Hello, I'm Dr. Hansen. I'm president of Interventional Pain Specialists. Since you're on our website, you're likely a pain patient looking for the proper pain physician. I'm going to touch on 5 or 6 quick topics. Afterwards, perhaps you'll know if Interventional Pain Specialist is a good fit for you. The topics are as follows. First, our physician awards and internet grades. Second, would be our understanding of your pain. Third would be the training, knowledge, experience of our pain physicians. Next, opioids. Next, treatment plans, and possibly briefly touching on malpractice and opioid overdoses. Let's get started. First topic would be awards. As you can see, IPS has won over 30 physician awards over the past 10 years alone. Not only that, but even more important is our internet scores. On social media, which include the usual Facebook and Google, I would check Healthgrades, Vitals.coms, Yelp, and so forth, and see what our patients are saying about us. We consistently score over 4 out of 5, I believe presently possibly 4.3, 4.4 out of 5. But the comments are what's important. See what the patients say about us, how we take care of them, and what kind of outcomes they get. This will be very useful. Also, I'd like to talk about the understanding our physicians have for you as pain patients. We feel that we understand your pain very likely more than other pain physicians. Why? Because I have undergone 4 back surgeries. So I know what it's like to live with spine pain on a daily basis. I'm also a patient at IPS. I'm not only treating pain, but I'm getting treatment for pain. So I understand both sides of the fence. I understand your position. I know what it's like to lay down on a table being a little bit scared of what kind of treatment you're going to get. But this understanding has helped us do better, take better care of you, make your experience much more enjoyable, and we look forward to possibly putting together a plan for you. I've only missed 1 day of work in the last 15 years. Perhaps something that's worked for me is something that could work for you. The next topic would be our physicians and their training. I'm a very good recruiter, and I've been able to recruit physicians to join us from some of the best universities in the country. We have physicians from the Mayo Clinic, Harvard, the Cleveland Clinic, and 10 other of the best universities in the United States. And what have we done with all that knowledge? Well, we've synthesized it, put it together for treatment plans for our patients. We've taken the best of the best information and we'll customize it just for you. We even have a doctor joining us March 1st, a Dr. Michael Andrews, who trained at the Cleveland Clinic and just finished a couple years helping the University of Minnesota set up their pain program and improve it. Next topic would be opioids. It's a really hot topic now. The latest statistics are alarming. They show that almost half of pain clinics will not accept a new patient on opioids. Yes, it's true. If you call up a pain office, they may not take you if you're on opioids. Why? Well, now the scrutiny is so high from the government, we have to undergo a lot more paperwork, a lot more due diligence to make sure the patients are safe and the community is safe. But we're willing to undergo that. Some physicians aren't. Not only that, but we're all aware of other fellow physicians that have had their licenses restricted because of the way they prescribe. So some doctors are putting themselves and their own safety ahead of their patients. At IPS, we're not going to do that. We're patient advocates first, and we will put you first. If you need to be on opioids and it's medically necessary, and we can find a safe way to do it, we will prescribe for you. That being said, if you've been on opioids for 10, 20, 30 years and have developed a great physical dependence, it may not be in your best interest to be on very high doses. We may do very small weans, perhaps 5, 10% every 1 to 2 months if necessary. But if you fail, you fail. We're here for you. We feel that opioids can be an important tool for pain management, and we're not going to ignore it. And that being said, we have several other options other than prescriptions. Moving ahead into our next topic is treatments. And as I said, taking the best knowledge from the best universities in the United States We have some options that other offices or pain clinics may not have even suggested to you. I can't tell you how many times I've met with a new patient, and the patient is almost in tears because they now have hope. They didn't know there were other options available. We're here to give you those options. We're here to give you hope, and then we're here to get results. Finally, it's not something we talk much about, but IPS incorporated in 2001. Since then, we have malpractice cases totaling 0. We do things safely, carefully, calculated, skillfully. We get great outcomes, and we look forward to helping you. I'm Dr. Hansen. I'm president of Interventional Pain Specialists, and we look forward to meeting you and doing what we can to help you. Goodbye.